As two practicing physician assistants, we've seen a lot and we've heard a lot. We know that you've heard a lot too. We are here to help you navigate through the BS by having open and honest conversations with other practicing professionals. I'm Heidi.
And I'm Cassie, and welcome to Mindfully Woman.
Okay, ready?
Love it.
Hello, everybody, and welcome back. Solo episode today with your two favorite hosts, Heidi and Cassie, which is us.
Hello.
Today, we're going to keep it a little light, a little casual, a little fun, and we're going to be talking about vaginas, and in particular, vaginal dryness.
Which is something we hear a lot, actually, in the breast cancer world. So we, of course, are not treating this every day per se, but we do have a lot of tips and tricks, I suppose, to vaginal dryness.
Yeah.
And
risks, things to help treat it. It's actually a really, really common issue. A lot of people think this is like one of the big postmenopausal symptoms that people deal with, which is true. A very large percentage of postmenopausal women complain of this, but actually premenopausal women can also complain of this. Up to 40% of premenopausal women actually complain of vaginal dryness, which is...
That's a lot.
A lot. That's at the high end. I think it's a big range. It's like 15 to 40% per the data, but
it's still, even 15% is a lot.
It is a lot. And I wouldn't have suspected it, but when you get into the nitty gritty of what some of the common reasons why people experience it premenopausally, it does make sense. So yeah, we're just going to kind of dive right in. Like why? Like why does that happen?
Yeah.
So one of the biggest risks is because of lack of estrogen. I mean, everybody thinks of that with menopause. Estrogen deficiency, just like huge downfall. That's like the number one thing with menopause. But like we've talked about before on previous episodes, you can also have estrogen deficiency from being surgically induced at a younger age.
Yeah, which is huge, which obviously we've seen in both of our jobs with our previous jobs in gyn-onc, but also now too in breast cancer, whenever we are surgically and medically inducing menopause or significantly decreasing estrogen production, then dealing with the vaginal dryness, it can be very bothersome and having a lot of different side effects too that are even more than just painful intercourse, which of course that's what most people's thoughts go to. They're like, oh, well, it's just hurts when I have sex. I just need to have a lube. But it can be so much more than that and so much more uncomfortable in the daily life. Yeah. So it's no longer a taboo thing to talk about.
Agree. And then a lot of medications, like if we're thinking more like premenopausal women, women still on their periods, like antidepressants, anti-anxiety medications, psychotropics, like antipsychotic medications.
Yeah, for like bipolar
disorder
patients and like schizophrenic and
those can cause
those
vaginal
types of
dryness.
patients. Yeah,
beta blockers for blood pressure, particularly like the beta blocker class for treating high blood pressure can cause vaginal dryness.
That makes sense.
Yeah.
Yeah, and it's like so many people are on that. Even young women are on that medication for blood pressure, but also like heart rate issues too.
Or even like, I feel like that could compound a woman who's going through menopause. And let's say, unfortunately, they're at that age where they're starting to have blood pressure issues. Well, if they're on a beta blocker, it might even make that vaginal dryness even worse. Yeah. So just like something to think about if you're like, oh my gosh, this seems like exponentially worse.
And when we say a beta blocker, usually the most common one is metoprolol. Anything that ends in a lol.
Yeah, lol.
What's the propranolol?
Propranolol is one. Those are really the two most commonly used.
Ones.
Labetalol is not really used in like normal population.
Yeah.
But yeah.
So
in the hospital.
Those can cause it for sure.
Also, oral contraceptives, combined OCPs.
Really?
Can cause some of them, not all of them. So I don't want like people to get scared about their birth control. But if you are experiencing vaginal dryness on your birth control pill, it may be because of the type you're on. So some certain brands, and I am not savvy enough in all the birth control brands that are out there.
There's so many.
There's so many. Some of them have progestin in them that has more anti-androgenic properties, which basically is just a fancy way of saying it's going to heighten that response to cause vaginal dryness to happen. I actually was looking up some of the data behind that, and common brands that have those types of properties were Estelle, Yasmin, and Yaz. Those were like the 2 or 3 like top 3 ones that had like those highest properties in them with the most reported side effects of having the vaginal dryness associated with them. So also just something to keep in mind if
if you're like, oh, actually I am having that symptom and I am on that medication, maybe that could be why.
Yeah. And also because of that too, it's not even just like decreasing vaginal secretions, but it also can decrease arousal response. So it's kind of like lack of libido, which then probably turns into too like more vaginal dryness because not as much is going on down there, I guess.
Yeah. And that's what we were just looking up before this episode, that is vaginal moisture, linked to sexual arousal? Because I have read before that no, it's not, but most observational studies, so then they go and they ask people like, well, what do you think when you are aroused? Do you get more, lubrication down there? And overall people say yes. Yeah. So that was the common consensus. So maybe there is relation, but
mixed data.
TBD. Yeah. Overall TBD. But, if that doesn't happen for you, then might not be anything related to arousal.
Yeah.
Yeah.
Might not be.
So anywho, that was a little caveat, something that we were talking about beforehand.
It was a good caveat.
Yeah. Thanks.
Another one with birth control wise, depot shots. Really high amount of depot shot. I mean, it's progestin, and it can. Scratch that. Hold on. What are we at? Is it like progesterone? I don't want to say the wrong type of birth control. Okay, so the depot shot is a progestin only, and that causes a very, very low estrogen state. And estrogen, as we know, is good for vaginal lubrication, and because of the amount of progestin that a depot shot can occur in the body, that's why some women can have vaginal dryness. It doesn't occur with everybody, but it is a known side effect that can happen with that too.
Yeah.
So
the good thing is, I think those birth controls like the Yasmin, Estelle, maybe Estelle is more commonly used, but then the depot, I feel like it's losing popularity too, because there's so many other side effects. I know definitely with the Yaz and the Yasmin, it seems like those have really been fading out.
Yeah. And I think, like you said,
see it as much.
So much more side effects that go with it. I know in general, like Sprintec was a common brand. Yeah. Like when I was taking birth control pills, I don't really know what like the big brands are right now.
Yeah,
low estrogen is a common one too.
Very common. I don't even know. I don't remember now.
Yeah. So like I said, I'm not up to par with all of these birth control names. There are so many out there.
There's a lot.
And they all come with different types of side effect profiles. But those were the ones I found that had biggest
most
association.
Notably. Yeah. That makes sense.
With the vaginal dryness. And then when we're talking about anti-anxiety, antidepressant drugs, SSRIs or selective serotonin reuptake inhibitors, which is most commonly the things like sertraline, which is Zoloft, Lexapro, Celexa.
Yeah.
Those are the SSRIs. And then like venlafaxine or Effexor, duloxetine, which is Cymbalta. Those are SNRIs. And those are all kind of anxiety, depression medications. Those can have side effects of decreased sex drive, decreased libido. Vaginal dryness can come along with it. But the thing is, you gotta have to weigh like the pros and cons of that. Like if your mood's so much better and you feel like you're well controlled from a mental state, but let's say your libido's in the toilet,
right?
Is it worth getting off of it? That's a very personal decision.
Yeah. But high anxiety, high stress, depressed mood can also lead to low libido. So everything in medicine in general is such a risk versus benefit, and like what works for you. And we were even talking about like it could be the difference of generic medications, like a generic brand of or sertraline or something like that, generic of sertraline versus another generic of sertraline could have different impacts or different side effects. It's really crazy. I know I experienced that with with the different generic birth controls. Like one was really, it had a lot more side effects, and then the other one was totally fine. So sometimes playing around with that, you might notice some changes.
Yeah. I think we both had patients that notice a difference in the manufacturer, like whoever's creating the drug. If I don't know, I'm just like throwing out a name, but like if Pfizer made this one and I don't even know. Lilly made this other one, then, they do better with like one or the other, which I personally am so lackadaisical when it comes to noticing those things. I don't know if I would even have like paid attention to notice a difference, but I think that's good to be diligent to know.
For sure.
I also suck at taking meds.
Yeah, it's like you don't take any meds or supplements.
I can only take gummy vitamins. That's where I'm at.
She's strictly 5 years old.
And ibuprofen and Tylenol.
At least you can take those.
Yeah.
Yeah. But the good news is, if you are experiencing vaginal dryness, there are options for you. Of course, too, it's determining, all right, well, is it vaginal dryness? That's something that's bothering me every day. Like when I'm just walking about, does it feel like sandpaper? Are you rubbing together and it's super uncomfortable? It can also lead to some like urinary incontinence and things like that. So it might not just be your pelvic floor. It can also be because the lack of estrogen in the vaginal tissue is making all of that fall a little bit.
Yeah. Because it throws off your pH. It just throws off your whole microbiome too. And everything just gets completely out of whack.
Definitely. Or even too, if you're having multiple UTIs, yeast infections, things like that. It could be related to low estrogen or vaginal dryness, things like that. So it doesn't have to just be during sex or time of vaginal intercourse.
Yeah. Because I mean, like dryness, itching,
burning,
soreness, burning.
Yeah. Sometimes it can even cause like vaginal bleeding because it's so dry, and like I said, the friction.
Atrophy.
The friction from walking around can cause that skin to break down, and then you can have bleeding, and then that tissue the vaginal walls can thin out and can cause bleeding that way too.
Yeah. And I think we especially worry about that when we get to the postmenopausal state.
Yes.
Because of such that lack of estrogen.
Because
then too, like the outside of the vagina, like the vulva, like the external part can also be affected and become dry. And that's like kind of what you're talking about in terms of like rubbing together. And that can start to atrophy too. But of course, internally is where you really have a lot of the damage, but you just can't see it, unless somebody does a pelvic exam.
Exactly. And when she says atrophy, she means like the tissue literally just sort of disappears. And so this is a PSA. If your vagina looks different than what it used to, if it's looking like the outside is sort of pulling back, and I don't even know how to describe it. It just looks dry and the skin is sort of disappearing. You might have vaginal atrophy. And so that is something that vaginal estrogen can actually be pretty helpful for.
And I think these are
medically necessary.
These are like those like weird things to talk about because people don't want to talk about it as much. But these are the things that we want you to know about. Yeah. And know that it's very, very common, but people just don't talk about it.
Absolutely. It's so taboo. But women, listen, you don't have to live with this.
No.
There are options. There are providers out there who are like, yeah, we can do something about this. I love that like menopause is having its moment. And so then a lot of other issues coming about with like women's health in general is having its moment. So then there's more providers out there like willing to talk about it. So if you're thinking to yourself, listening to this, like, oh, actually, I think I'm experiencing that. Go talk to somebody. Have a pelvic exam. And they're not scary. Hopefully not.
Most of the time they're not.
Most of the time they're not.
Just do your research and read reviews.
Yeah, absolutely.
But But how we can take care of it, let's jump into that.
Yes.
How do we treat vaginal dryness? That's what everybody wants to know.
Yeah.
There's non-hormonal options and there's hormonal options is like the best way to think about it. So when we start getting in the nitty-gritty of the non-hormonal stuff, we're thinking things like vaginal moisturizers and vaginal lubricants. And there's different brands of each of that. But when we think about each category, when we think about a moisturizer, that's something that's going to basically bring life and vitality to the vaginal tissue. And that's going to work long term.
Yeah.
And so that's not something you're using just on an as needed basis. This is something to keep things sustained as time goes on.
It's like putting lotion on your face and on your body every day. Or most of the time with these, it's like every other day or 3 days or something like that.
Yeah.
But yeah, it's like just like you would put lotion on your skin. Same for in your vagina.
You put the lotion on the skin. I'm so sorry. I have this bad tickle in my throat.
Ditto. Do you need a pause?
No, I'm good.
Okay.
Anywho. So moisturizers, yes. Putting the lotion on the skin. The common ones for moisturizers, when we think of like the most commonly used brands, Replens is like one of the highest ones up there.
I feel like the OBGYNs really promote Replens. And
it's over the counter. It's really easy to find. It's really easy to buy.
You can just get it at like Target, CVS, wherever. I don't think
it comes out of 7-week supply normally.
Wow.
Which is pretty good because I think I looked up the cost and I think it was roughly right around $20.
For 7 weeks? That's not bad.
7 weeks if you use it as you should, which is every 3 days. And it comes with an applicator. So think of like a tampon, but a really, really thin version of a tampon. So it turns some women off because they don't want to put tampons in anymore, but it's so much different. It's not like it's so much different than a tampon. It's easy, you know, and you put it, typically it's recommended to use the applicator at nighttime before bed. So it has the full nighttime too.
And then it's not so messy, you know, once you put it in there, then you're up walking around, it might, you know, come out. So it's better, works better if you're laying down. Very similar to if you've ever used like a monostat. Like for a vaginal yeast infection, over the counter monostat.
That's a good way to, that's a good analogy.
It's very similar to that.
There's also one that's made with hyaluronic acid. The brand of that one is called Hyalogyn, Hyalogyn. And they do also sell that over the counter too, but I think it might be more off brand. Like it might just say literally like hyaluronic acid suppository.
Yeah.
If you buy it at CVS or Walgreens. And it's the same idea. It's every 3 days.
And the same way. I think it's overall recommended to find a moisturizer with hyaluronic acid because just like how it's really good for your face and retaining moisture in your face, the skin on your face, it's also really good for your vaginal tissue as well. Yeah, it helps like retain that moisture even better.
Makes it vivacious.
So, if you can find vaginal specific moisturizers with hyaluronic acid in it, that is overall better. Yeah.
So I would say those are the two like top brands in terms of popular factor and efficacious. Like they're the most like well studied. They work pretty well. Women like to use them. They're pretty easy to use. But there's so many other ones I do believe that are out there. I mean, even going on Amazon, I did a quick Amazon review of them, and there were hundreds of different types that popped up on there. But I would say if you're wanting something that OBGYNs recommend, the general medical community recommends, those would probably be the top two. And then we go into lubricants. And so that's different than the moisturizers. The lubricants are the ones that you're using as needed during sexual activity.
For the sexy time.
And that's to reduce the friction. I mean, it makes sense. You know, you're not going to expect that the vaginal moisturizer is just going to work its way magically to act like a lubricant when it's time for you to do the ditty. Like you have to do your due diligence and
still use
a lubricant.
I typically recommend, I don't know what you typically recommend. I typically recommend like a water-based lubricant.
I do too.
Because the silicone base, I've heard is really messy, but it also dries out the vaginal tissue more after the fact. So just like, I think like silicone products in your silicone in like your hair products and stuff like that can dry out your hair more. And so same thing with your vagina. So if you're using the silicone based lubricants, then yeah, it's kind of doing the opposite of what you actually want. So the water based lubricants do a lot better.
Yeah. Water based is best too, because it helps, like we were talking about, the pH balance of the vagina.
Oh yeah.
Most water-based lubricants, or the good water-based lubricants that you'll find, keep that pH. You want a pH level, I think it was between 3.8 to 4.5. Yeah. And like with a low osmolality. Those are the safest ones to use and like the best types to use. So yeah, I also say to use a water-based lube too.
Yeah. I feel like those are just the safer ones, and people have less like reactions and stuff to them.
Yeah. I personally like never truly ever like looked into good brands that were out there, but by doing some research I found two that were recommended. One was called Good Clean Love, which I have seen at the store.
Oh yes, yeah. They have a good vaginal moisturizer too.
So yeah, there you go. Moisturizer and lube that they have. Oh, and the Hyalogen, I forgot to mention that too. The moisturizer we talked about, they also have I think a daily use, which would I think theoretically be considered a lubricant.
Yeah.
So
interesting.
Yeah. But yes, Good Clean Love has one. And then there was one called Sliquid. I have not heard of that one, to be honest with you. But
Sliquid, wow.
But my in-depth search said that it was a good one.
Yes. So just do your research. Do whatever you feel would work best for you and whatever you and your partner feel comfortable with and aren't having reactions to.
Yes.
Yeah.
Another thing that's non-hormonal that, well, there's a few others that I haven't mentioned quite yet, but if we're talking about like that would be hormonally. Sorry, let me reverse there. One other non-hormonal thing that would be out there is called the Mona Lisa, which is laser energy based treatment to the vaginal tissue. And I personally don't know like the specifics of all of it.
Yeah.
But we were talking about it and also doing some research on it ourselves. And it's kind of more experimental use than like truly efficacious, meaning that it truly does wonders or works magically. Like that's not what we're saying.
I really thought it was like more well studied than what it actually is, but I do have several patients who have used it and it's good. So it is actually a procedure that you go in for. It can be done in the office. It has to be done by a trained provider, and they literally use a laser and laser the vaginal walls. So when we say vaginal walls, that's not like your cervix, your uterus, anything like that. It's literally the
vagina,
the tube.
Yeah.
And so they actually go and they laser all of that. So then it causes that damage to the damage to the walls, and then that stimulates more growth and more blood supply.
Yeah.
Yeah. So I don't know. Sounds really painful. But I know women really...
I feel like some women, though, I feel like I've had some that have done it, and it's not been so bad.
Yeah. I mean, that's great.
I don't know.
I think, too, it's not something covered by insurance, so it's all out of pocket. And I think, like, one session is $1,000 plus.
Really?
Like, it's not cheap.
Oh, that's crazy.
I mean, I could very well be wrong, but if I remember right, it's not a cheap thing. And so usually it is if you have failed...
So
all of these other like over the counter moisturizers and things like that.
Even to hormonal based. Do you know that? Like if they've tried estrogen, which we're going to get into that in a second, but like women who have tried maybe estrogen therapy or estrogen vaginal cream. And
I think so. Yeah.
Because I thought that was the case. It's kind of like almost a last stop shop before insurance will remotely cover anything of it.
I don't know if insurance covers it
at all.
Ever.
And that's why most people don't do it, because it is pretty expensive. Or as of this point, I know a lot of people don't
From my
do it.
understanding, I don't think insurance covers it ever. Yeah.
Yeah, I don't really know that much about it. I feel like how old is it? Because I feel like when I started, I was rotating PA school in the office I was working at for OBGYN, which was a pretty well-known entity in Indiana. They had just got it at the office.
Yeah.
At that point. And so that wasn't terribly long ago. I mean, that's been within 10 years. So
Yeah.
still seems fairly new.
I think it is fairly new. To how old it is, I'm not sure. But I personally only know of 2 people who
Have
do
used
it in this area. Yeah.
Crazy.
So it's definitely something to, there are options out there. And then, like she said, there's another non-hormonal option is oils. So like
Yes.
a lot of women I've been noticing or have been told that their OBGYN is recommending like coconut oil, which is fine.
Yeah.
Coconut oil is easy. You can get a big old tub of it at Costco.
It's also really good for popping popcorn.
Yeah. Popcorn, rice, whatever you need. And then also just put it in your vagina too. Just one-stop shop.
One-stop shop.
I put it on my skin, like whatever.
Sometimes I do it on my scalp. It's good for me.
So
It's great for your skin.
coconut oil. But we did learn that the oils can break down latex condoms.
Yes. So be careful.
So did not realize that. If you are not wanting to get pregnant and obviously you're still having periods and all of that, but you have vaginal dryness and you're using coconut oil, beware.
Yes.
That it will break down those condoms. But the other type of oil, and I've seen a lot, is also the vitamin E oil.
Yeah. That's good for vaginal tissue.
Yeah.
We are not saying go out and get the vegetable oil and the olive oil and start slapping it on. That is not what we're saying.
No.
But these are the ones that are the safest, would probably be coconut.
Safest, and I think they absorb a lot
E.
better too. Like I think the vegetable oils, I don't know. I feel like you just like kind of smell weird.
Yeah, you'd smell like French
feel like
fries.
Maybe, I don't know.
Maybe someone's into that. I don't know. It could be. Could be a turn on.
But
could help.
Yeah, I don't know. But I don't know. I feel like it'd be messy. Like
Not
maybe it wouldn't
recommending.
absorb very well. I would try the coconut oil and vitamin E
Just
more.
play it safe. Go with the coconuts.
And then so now back to my other thought is we talked about the non-hormonal.
Yes.
Right, we're done with those.
Yes.
And then the next is, of course, the hormonal, which even from a breast cancer standpoint, now it is approved from the the American Breast Cancer Society, that even if you've been diagnosed with breast cancer, hormone positive breast cancer, it is okay to be on a low dose of vaginal estrogen.
Yes.
Because there are a lot of benefits to being on vaginal estrogen, and such a little tiny amount actually gets absorbed into your body. It all pretty much stays locally or stays right in your vagina. And so
this is like a huge win for those in the breast world, because hormones are such a hard topic for us to talk about. And so if we can even just use the remotely tiniest bit of hormones for women that they'd benefit from, I mean, it's huge. And this is, like she said, been proven to be very safe for
very safe.
Risks.
Yeah, absolutely. And so those breast cancer patients out there, if they're on any sort of, so with breast cancer, especially hormone driven breast cancer, we take all of their hormones away from them. And so it doesn't really matter their age. And so if we can do a little bit of something to make them feel better, we do our best. And so that's where Heidi and I get more involved in this sort of thing. But the other thing is menopause. So obviously with menopause, your ovaries aren't functioning anymore. They're not producing nearly as much estrogen, or none at all. Mm-hmm. And so if you're having just vaginal dryness, then it might not be a bad idea to actually look into some vaginal estrogen. And I believe it's just like a pea-size amount, just a pea-size amount that you just put right inside your vagina. And it's like every 3 days.
I think so. I do think there's like a loading dose.
There is a loading dose.
Or two. A little bit higher maybe at first, but
yeah, maybe is it? I don't quite remember the dosing of it, but yeah, there's a loading dose for like a couple of weeks, and then you do it less frequently. Yeah. After that. And so just like these lubricant, or just like I
think I even have some that use it like once or twice a week.
Oh, that wouldn't be so
I think
bad.
I have some ladies that just kind of do it like that too, and they just get a little bit. They just want to use the lowest dose possible.
Yeah, and sometimes too, doing it as prescribed is like too much. I've had some women say like it's too messy, or it causes too much too much moisture, and then it's like uncomfortable. So you kind of have to titrate it to your symptoms and how comfortable you are, I suppose.
So we're on board with low dose vaginal estrogen cream. in terms of reducing risks and things. But there are also other modalities out there too. So it's not just creams. Like they also make estrogen vaginal tablets. They also make
and the rings.
That are out there too. I personally don't know enough about the dosing of those, and or two, I don't have a lot of women that prefer to do that.
No, usually they like to do more of like
just because they like the gel, the cream. It's easy to use, and it's well controlled and easily dosed as well too. So I just I mean, I think it's very patient specific as well, but the dosing too is a little bit different too with the tablets and the rings, but they're all shown to be like a lower dose formulation.
Okay.
So I actually like have a little bit of data here that tells us that having systemic absorption, so that means the amount of estrogen that has been absorbed through the bloodstream throughout the body from low dose vaginal preparations such as estradiol tablets, estradiol rings, or conjugated estrogen creams, and these are all at low doses daily. I'm just not going to have to name all those off for you, is minimal and does not raise serum estradiol above postmenopausal range. So any of those little small formulations at a low dose hasn't been proven to increase any risk or go above, like we said, where the hormones should be in menopause anyway. So that's great.
That is really great. It's like finally women, like there's more evidence that women can actually get some relief from these symptoms.
Yeah.
Yeah.
And then so those are like the big 3 estrogen ones that are out there. And I've like kind of we talked about earlier, like a lot of women who suffer with these recurrent UTIs and they're like on antibiotics all the time, all over and over and over. They're the ones that are really probably going to benefit from having
for sure
vaginal estrogen and other things too. I mean, like painful intercourse and just soreness and burning and itchy. Like you're kind of having these UTI type of symptoms and you go to the doctor and you leave a urine sample, but there's nothing there. And then maybe they put you on an antibiotic. And then it's just like this cyclical response for a lot of these women in that 50 plus range. I mean, typically I have seen a lot of women like in their 60 to 70 range where they're dealing with that. And it's unfortunate and I hate it for them and it's awful. But those are the ones that probably would benefit from being on that.
Yeah, absolutely. And I think it was just approved by
American College of Urology?
Yeah, American College of Urology.
Or a Society of Urology.
Yeah, something like that. So it was just approved and like proven that actually vaginal estrogen can improve those urinary type symptoms. And even like this whole change in your bladder, your urethra, your vagina that happens from lack of estrogen. So you can get a lot of like incontinence too. That is separate from just like a weak pelvic floor. It could also be because of lack of estrogen and that tissue just isn't nearly as strong as what it used to be.
It loses just its elasticity.
Yeah.
And we lose a lot of collagen too, which is kind of a big reason why that vaginal tissue starts to thin out. So yeah. I mean, a lot of things are changing with that lack of estrogen. Yeah,
absolutely. Absolutely. And I will say too, unfortunately with the vagina, if you're not using it, you kind of lose it. I don't want to say completely lose it, but if you're not having like vaginal intercourse, like actual penetration, then your vagina, those walls do start to thin and scar down. And then that vagina does get tighter and then sex becomes more and more uncomfortable and all sorts of things. And then of course, if you had any sort of like radiation, so a lot of our uterine cancer patients, cervical cancer patients, it just exacerbates that and makes it so much worse. But even just at baseline, those vaginal walls kind of come in on themselves, and then it makes pelvic exams really uncomfortable. It makes sex really uncomfortable and all of that. So yeah.
Just a recipe for disaster, unfortunately.
It really is. Yeah.
So yes, we are saying this can be so helpful. So
this can be
don't sleep on vaginal estrogen.
No. And we'll say with starting these types of medication, obviously someone has to prescribe it for you, but you should also be having yearly pelvic exams.
Yeah, we are strong believers in this.
Yes, we are strong. As coming from gynecology, oncology, so like women's cancers, we feel strongly about this. And I've seen mixed reviews from like OBGYN groups, but I do believe you should have a pelvic exam every year. I don't care if you have your uterus. So many things can be happening down there that you don't know about until it's like, oh, how'd that happen?
We are not saying that means a pap smear every year. That is not
you do not
what that
need a pap
means.
smear.
There's guidelines for that, and that's should be followed as those are. But we're just saying have somebody look, make sure everything's looking okay. Make sure you have no new growth, anything that looks weird, and of course, looking at the vaginal tissue. Are there changes? Does it look thinner? Are you having symptoms too? And that can change from one year to the next year. And so, yes, I agree that it's important.
Absolutely. And to clarify, the pap smear is testing for cervical cancer. So that's that horrible brush that they put in there, and they swirl around, and it can be uncomfortable. But when we say pelvic exam, we mean actually putting that speculum in, where they open it up and they look and make sure your cervix looks good if you still have one, but then all of the vaginal tissue looks good too. Yes. So nice and healthy. So it's also important to continue having vaginal intercourse, or you can even get like dilators, and not even in a sexual way, like silicone dilators that literally increase in size, so you can keep your vagina open, so then it makes pelvic exams easier and more comfortable, because then it's easier for providers to actually see what we need to see.
Yeah. And they come like on Amazon, and they like come in like a box set.
Yeah.
And it
come in
comes
cool
like,
colors.
Cool colors. I mean, it's like, I don't know what sizing they use, I think, but I don't know if it's millimeters, but I think there's one that's like,
there's ones that are
literally
tiny,
like millimeters to half a centimeter or a centimeter, 2 centimeters. It just gets bigger as you go up.
And like I said, you don't have to. It's not just for women who've had radiation to the vagina or their pelvis. It's literally anyone.
Anybody.
Yeah.
Yeah. Especially those who maybe do struggle with some pelvic dysfunction or pain or pelvic pain, for unknown reasons or a whole other slew of reasons. Oh, another thing I kind of completely didn't even think about bringing up in terms of dryness too is like those women who suffer from like autoimmune conditions. So like Sjogren's and stuff.
Where everything just like
everything's just dry. Like those are big ones to think about too. I just kind of completely forgot, but that just popped in my head for like an example of a patient population.
Yeah,
that probably would benefit from that if they struggle.
Yeah. Wonder if like Lasix too.
It does, yes.
Yeah,
it does. Beta blockers and Lasix, so diuretics.
The water pills. A lot of people are on water pills. A lot of older women are on water pills. So it's just like so many factors that compound on
allergy meds
each other.
Too. Antihistamines can as well too.
See, why can't women just,
I know, right?
We can't live.
Can't live. What is this?
Why can't we just be comfortable, I guess heart's more important. But
but yeah, there's so many different things to think about when it comes out there. But on that note too, with the dilators, we're kind of going into a different wheelhouse here outside of vaginal dryness, but even pelvic floor therapy, there's like physical therapy for your pelvic floor for those women who do truly struggle with like painful sex or just pelvic pain in general, cramping, or they don't have much dilation to their vaginal tissue. Sometimes it is worth getting a professional therapist involved to do physical therapy for the pelvic floor,
and it's extremely helpful,
and it can be helpful. And then they sometimes they will use the dilators too while you're there, and it's very professional. It's very comfortable.
Yeah.
So that's even another thing too. We could go into that in a different way as well. But
because then that all really comes full circle to the arousal standpoint. Like if you're anticipating it's going to be painful, if you in the past it's been uncomfortable and it's just increasingly getting uncomfortable, then you avoid it, and all sorts of things. It really is a domino effect.
Yeah.
And then that can really place a lot of strain on relationships, of course.
It can, which we don't want that.
No. And so
it's part of being human,
Yeah.
This is
part of being female, unfortunately. But
but there are
options.
I was finishing your sentence. Options. There are also other things out there. I will say I'm not as well versed in like the other hormonal options outside of like estrogen. But there was like some different types of medications that people can take. Like there was intravaginal DHEA or prasterone is the medication. And there's also another one called oral ospamifene. I hope I'm saying that right. Like I said, I don't know much about that one. These were just kind of like other types of dosages and medications that could be used for vaginal dryness. I personally can say I don't see those prescribed often or used often. I do think a lot of women find success with the vaginal estrogen alone. On that point, though, when we're talking about like hormones and estrogen, it has not been shown that systemic estrogen therapy. So we're talking about hormone replacement therapy you take by mouth as a pill. It is not shown that has been as just locally effective for vaginal dryness.
Yeah.
It can be helpful for a lot of other things, but if you're wanting that specifically for vaginal dryness, I don't think that's going to be your best bet. I think using something more topical and local to the vaginal tissue is
I have
ideal.
seen or in my recent studies that some providers do a systemic or whole body estrogen in addition to vaginal estrogen.
Yeah.
So if you're having, the hot flashes, sleep issues, all of that, in addition to vaginal dryness, you could do both.
Yeah.
Yeah. And that's
fair.
not an abnormal way of treating all of that.
Yeah.
Yeah.
Exactly. But so like all this being said, when we kind of come down to the nitty gritty of like how to treat it and how to take care of it, a lot of societies out there, even like the Menopause Society in North America, they recommend trying all of these non-hormonal options first. So like the first line, the vaginal moisturizers, the lubricants, oils if needed, try that route first, see if that helps you, see if that's good for you. And then if it fails, of course, go to the hormonal options and try talking to your provider about being prescribed vaginal estrogen or an estrogen compound of some nature. But be very aware of your symptoms too. Like if you feel like they're really severe and you are dealing like with the chronic recurrent UTI type symptoms, like I wouldn't just sit on that and try the lubricants and try the moisturizers here and there and keep having these issues. I think that's definitely worth talking about and saying, I need something more.
You would probably benefit significantly more from the vaginal estrogen, just especially with the Urology Society coming out with that. Yeah.
Testosterone is one we haven't really touched much on.
Yeah.
But there hasn't really been enough data to say that it like truly helps with, I'm talking about topical testosterone.
Not in the vagina.
Yeah.
Like on your skin, right?
I think.
Yeah. I haven't heard about it being in the vagina.
I don't think they do about it. I've only heard of testosterone like on the skin. They like put it like on the thigh or the leg, like in the region, but like on the outside. But I don't think it truly helps that much with vaginal dryness. So that's why I'm not really talking about that one, because I don't have much to say about that one.
I don't know my thoughts on testosterone quite yet.
I think the creams, and this is a soapbox outside of vaginal dryness, I think the testosterone creams can be helpful in a way and probably are like more safe. I don't know, but I don't know enough about it.
Yeah, me either. All I know is I definitely don't agree with pellets.
No pellets. I'm in
no pellets.
No pellet.
Yeah.
They're not FDA approved.
Not regulated in any capacity.
The absorption rate is unknown. The side effects are irreversible if the absorption rate's too high, and we're talking things like deepening of the throat, really, really low throat, hair growth that nobody wants, like in different places, acne. I've even seen a report of a woman who saw an endocrinologist. This was an endocrinology report where she then started to like her musculature started to change too.
And
she got more bulky looking than what she was targeting for, and it was what it was by the
Yeah.
time that happened.
Interesting. That's surprising that it's not reversible.
Or like, yeah, it doesn't. They say it's irreversible, but I don't know, like, if you stop using testosterone and like you don't replace these pellets,
Yeah.
then like how long does it take for maybe some of them to go away? I don't know. I think
I
these
don't
are
know.
just starting to become a very
Yeah.
common thing
Yeah.
that are being used and told to use, and just something I don't believe in at this point.
Agreed.
But with that being said, we are really excited because this was kind of a little taste into a menopause type of symptom that we wanted to talk about.
Yeah. It was a really important one.
But we're having a big taste coming up soon.
We're excited.
Our next episode, we are going to be interviewing an OBGYN, and we are specifically going to be talking about menopause and hormone replacement therapy and her thoughts on it, because we want an expert on here and we want to talk about it and we want to give you guys the best information that we can. And it's been a very highly requested topic. And so hopefully we can dive into all the nitty gritty
Absolutely. Yeah.
of all that.
Agreed. Yeah, I'm very excited to hear her thoughts and talk to her more about it, because of course it is such a hot topic right now. And there's such limited data and information on it. So it's nice to pick people's brains.
Yeah.
And then, maybe you can kind of make a decision for yourself, but also talking to a healthcare provider about it.
For sure.
Yeah. All right.
Well, it was very nice to have you guys with us again today. Hope you enjoyed this episode. Of course, don't forget to follow us or like us on Instagram or our Facebook page. Always send us questions at mindfullywomanpodcast@gmail.com if you feel like you want to. But otherwise, we'll see you soon.
And like and subscribe at YouTube and Spotify.
Oh my gosh, yeah, those two. Yeah. Don't forget that.
We're all over the place. All right. Bye.
Bye. The information that you hear on this podcast is not a substitute for medical advice. As always, please seek out personal care and advice from your medical team.